Welcome to Wednesdays in the Hub and an hour chat with our neighbors in Bergen County. And we have a unique chat today. We have recorded interviews with 9 seniors on the topic of going forth with COVID-19. We also have 3 guests on our chart in our chat, health officers, Dawn Citrillo from Ridgewood, Judy Magliosa from from Paramus Health, and Dave Volpe from the State of New Jersey Health Department. Also, Susan McVeigh from Hackensack is with Dave. They will be responding to those who were interviewed and who shared how they felt, and we felt that they were a really good representation, the people we interviewed, of seniors in Bergen County. I think each of us will be able to relate to some of their experience and with some of their thoughts about going forward with COVID-19. In planning this chat, North Jersey Villages was looking to fill a gap between the uncertainties and questions of older adults and the valuable local health department resource of which we might be oblivious. Those interviewed were not given the questions in advance. I just want to let you know, so their responses are really spontaneous. So now we have an opportunity to meet our 9 neighbors as they answer the first question. And a question for all of you. What has upset you most, or has been most challenging about your experience with COVID-19?
What have you found that has upset you most about your experience with COVID-19?
What has upset me the most is the inconsistencies of the health officials regarding how to handle it. Initially they were saying masks weren't necessary, it wouldn't do any good. Then they changed their mind about that. They were back and forth a lot. They didn't really seem to have a good handle on it.
Of course, financially, I'm not working, so it kind of stinks. I am getting the unemployment. I'm babysitting, but I'm not back to my job with the crossing guards now 30-something years.
The social distancing, the restrictions on your activities and being with people that you want to be with. That to me has been the hardest. It's mostly the isolation of it.
I think the most exasperating experience was not be able to get out, not be able to go to a restaurant, not be able to go see a movie. It's funny, we don't see a tremendous amount of movies, but when you can't have something, that's when you want it. The underlying sadness is that all the people we lost, that's just remarkable. I think everybody will know someone who passed away. Many of them are elderly, died by themselves in nursing homes, which is sad.
I feel great sorrow for the business people and the restaurant owners and that are losing so much as a result of this. And I feel sorry for people because we are in general here social people.
What upset me the most during my experience with COVID was the different pieces of information that we got that changed every day or changed week by week. One week it was do this, the next week it was do something else. So it led to a lot of confusion and uncertainty.
We're stuck at home. I'm stuck at home. Communication with everybody is affected negatively, particularly my family.
Being cut off from my volunteer opportunities. I volunteer at the hospital, and I volunteer to teach children to read, and I tutor in an English ESL program. But that's going to be online, so I don't know how I'm going to do with Zoom. Yeah. But it's simply being cut off from people. That's been the hardest.
To me, it's a national tragedy of, what everybody is going through, whether it's working from home or schooling from home or losing jobs or hunger food insecurity. I mean, it's just a cascade that has basically devastated our country and devastating the world.
It speaks of a cascade of what everyone is going through, and based on local health department data, in this cascade, what are the most common challenges of COVID-19 for older adults? And I'm fielding this question to our health officials who are with officers who are with us.
I just wanted to say something up front with the virus. In the beginning, when it first came out, it's a new virus. And because you're saying there was confusion and people were changing and the health officials were saying one thing and then they changed it to another thing, that's what we're all following the CDC guidelines. It's such a new virus that nobody really knew too much about it when it first came out. So we're all following state and CDC guidelines that are telling us what to do. So even in the beginning, if you remember, Dr. Fauci said no masks, then he went to masks. So it's confusing because it's a new virus and we've never been through anything like this before. But I hear all your frustrations about your the challenges, and I agree that it's hard, but it's hard on everybody.
So aside from the ones that were voiced, what are the other common challenges that seniors in Bergen County have been facing?
I guess I'll try and field a little bit of that. One problem is that I've noticed that in a home environment, people tend to become a little relaxed. And if an elderly person is living at home, perhaps their children or visitors may not come into the home where everybody feels secure in the privacy of their own home. So the masks all come off. And, in the beginning, before we knew much about the COVID, people were going to assisted living facilities unmasked because they weren't symptomatic of COVID. I don't know if you recall, but there was a time when it was okay to visit your elderly parent in an assisted living facility because we didn't know that there was an asymptomatic stage of COVID. So those are some of the challenges that we've had. Then they found out later that COVID can be transmitted even though you don't have symptoms of COVID. And then the guidelines change, and that may answer one of the questions the first gentleman spoke of earlier. He says things keep changing and information keeps changing. That's because, as Judy said, we're getting new information almost on a daily basis as the scientists find out more about COVID. They call the CDC. The CDC calls us, and it trickles down. This is a novel virus. We've never seen anything like this before. But anyway, I know we only have an hour, so I can carry on.
No, thanks, Dave.
But anyway,
good focus on the at-home, that we need to still be vigilant at home, even within our own pod. So
yeah, especially, can I give you an example? I visit my elderly mother. I visit her, and one of the first things I want to do when I visit my mother is I want to hug her and kiss her. And she lives in Oakland, and she's not wearing a mask. And I come in with a mask, but then I want to hug her, I want to kiss her, but I haven't been tested within the last 3 weeks. And so I'm not sure if I'm transmitting the COVID to my mother. And I'm a health officer. I work for the state, and it's really hard because you want to touch people. It must be very lonely for her.
Another ongoing challenge for many is deciding whether to be tested or not. So you talk about having been tested 3 times. Some of us haven't been tested at all, and some of us have, for numerous reasons, been tested. And there are so many questions surrounding testing. So our next question to our 9 seniors was about testing and what they would do if they tested positive. So Columbus?
Have you ever been tested for the COVID?
No,
No.
I've
Okay.
never had any kind of symptoms. I haven't been sick. I've been really good. I did go to my doctor. You need to be careful. I'm a diabetic.
Oh, right. So you have to be careful.
So this is why I'm like really careful about who I'm around.
Because my wife came down with it. She had a mild case. It kind of had her out of commission for a couple of days. At the time, we didn't realize it was COVID because her symptoms were more intestinal related. But after, she had an antibody test because she works in a health facility. And after she came back positive, I went and got tested. And I got tested twice because I know there's been some false positives or false negatives.
Just an antibody test. What would I have done differently? Nothing, because I have no idea. Because I have no idea how long those antibodies work and how
Right, right.
how effective they are.
No, I haven't. I probably should. We just have Valley Hospital across the street. I guess I could have the COVID-19 test administered there.
I'm one of the millions who got the test when I had to go for a procedure. Yeah, I came back negative. It was one of those things where you didn't put the swab up your nose. You had to, they made you spit into a little cylinder, and it wouldn't give you any water or anything to put in your mouth. And I'm standing there, I'm sitting in the car, and the sun is beating on me, and my mouth is dry. And I go, how am I going to do this? But you got through it.
I had a scheduled medical appointment. And before I could go, I had to go get tested because otherwise they would not have let me in the building. But negative all 3 times. So that was encouraging. Well, if I had tested positive, first I would have called my doctor and gotten medical advice from him and followed the directions thereafter.
From what I understand, for the most part, you have to kind of isolate yourself, stay at home.
Since there are 2 other people in my home, and we live in an apartment, so I don't know. I would have to try to isolate myself, but they'd have to go be tested immediately. We did have a neighbor downstairs, the 3 of them got it, so they didn't come out of the house for 3 weeks. And I guess I would have done the same thing. You know, have the food come to the door, that kind of thing.
Right.
Yeah, you know, we were as careful as possible with cleaning and everything because my husband is, he's handicapped, plus he has COPD. So I wanted to keep him away from it entirely.
I can give you a story without getting into too much detail, but doctors were called by someone in my family, and the doctor told the individual the best thing to do is to just take some Tylenol and see how you feel in the morning. There was basically in March and April and May, I don't think there was much you could do except just write it out and hope that you didn't get it. I think I feel a little more comfortable now that we have a lot more that they know about and how to handle it.
Give us, to our health officers, can you give us some basics? When should we be tested? What types of tests are out there? Where are the testing sites and how do we find out where they are? Do I need a referral, an appointment? Who pays for the testing? And what should we do with the testing results? Are they important to hold on to?
So basically right now, the county is doing the mobile testing sites. That's a great resource to go to one of those sites. They do the saliva test, which is a little bit easier. You don't have to have anything stuck up your nose, and the results generally come in a few days. Or you can call some local emergency immediate, what are they called? Appointment. Some of them are doing rapid tests. Some of them are doing PCR tests, which take a few days. Generally, your insurance covers them, but if you go to the county site, it would be covered either way, whether you have insurance or not. What will happen afterwards is you'll get a call from your doctor letting you know your results. And if you're positive, you will then get a call from the local health department, the public health nurse, or the contact tracer, and they will reach out to you and find out where you've been, how you're feeling, what resources you might need, and then we can refer you to any resources that you might need if you need to stay home and quarantine. It's very important that you take the call if you are positive, because we need to do the contact tracing. It's important to protect the people around you as well as yourself. And if you need to know where the testing sites are, there's a COVID-19 website, and it's covid19.nj.gov. And you can go right on there, and there's a link that shows you where the testing is locally.
Thanks, Dawn. Okay, how are those who are with and without internet access being informed about all this testing information?
So on the news, regularly, they're talking about where you can go get tested. They can call the local health department.
In the local papers.
Yep, and in the local papers. But they can always call the local health department, and a lot of times we look it up for you if you don't have access to a computer, and we give you that information.
Okay, so you're a great resource. When someone has tested positive, as you mentioned, they might be called by a contact tracer. So that was our next question to our group of 9. And so that's where we went next.
You did get a call from a contract tracer. How would you respond to that call?
I wouldn't have a problem taking a call and being forthright. I think in the end, it's all good information that they're trying to collect to try to get a better handle on how this disease is spread, and just as importantly, how it's not spread.
If you're hiding it, you're not protecting other people around you.
They ask you anybody you've been in close contact with, and how long ago, and yes, their names and that sort of thing. I wouldn't feel it was an invasion of privacy because those people I had been with need to be able to protect themselves and others by quarantining.
I would have helped. I would have tried to figure out, I don't, think about it today, George. I saw you, how many people you bumped, we're not moving around. How many people you've bumped into today? It'd be difficult. If you're in a store and you're asymptomatic and you're walking up and down the store, you're bumping into people, even though you're 6 feet away, you might be walking by them. Yes, I would do my best to give that information to the contact tracers, because I would want somebody else to get it, and I would want somebody to get it and then give it to someone who has comorbidity, and that person pass away. That would be tragic.
I don't know what I could tell them.
You just tell them where you were, who you were around, where you've been.
In fact, I've even thought about signing up as a contract tracer. I just got time on my hands here and there.
Yeah.
And, I thought it might be a productive thing to do.
Oh, I would say yes.
Yeah.
Definitely, because I would want other people to know who were around me that they could possibly be at risk.
But I believe that tracing is vital because, one person causes it for, 2,000 or something by the time they're done.
Right.
I would be very open to a tracer. I don't think tracer questions would impact on my privacy. I would like more tracers and less loopholes.
People are very positive about responding to contact tracing, but a recent article indicated that only a little over 50% in Bergen County of people who are approached by contact tracers respond positively. Can somebody speak to that dichotomy?
Hi, can you hear me?
Yes, you can.
Yeah, well, it started, Judy Migliaccio from Paramus had a lot of experience with this because of, it was an early incident in Paramus. However, okay, Judy, I'm going to trade places with her because there's some technology issues with her laptop, all right?
Aye.
Thanks, Judy.
So I just want to go back to the question before is why would you get tested, or who would get tested? So you would get tested if you think that you might have been exposed to someone. You'd wait like 5 days and then get tested if you want to know if you were are positive for the virus. Kathy was right about the 50% are not answering the questions from the contact tracers. It's very important that you comply with the contact tracers when they contact you. That's how we find out where the clusters are and where the virus is and how to try to contain it in a quick manner. They did find out that restaurants are probably not the cause of viruses that are positive, gyms are not, and it's mostly from gatherings, and especially indoors. We know that indoors is much worse than outdoors, and you have to be truthful when you talk to the contact tracer so the contact tracer can find out and try to stop.
So are they, should they be concerned about fraud? So can,
And it's out there.
yeah, I know. Well, Dawn or can you talk to fraud and how you can?
Yep, I can talk to that. If a contact tracer calls you and you're concerned that it's a fake call, you can ask them for, the local health department's number, and you can give them a call, which we've had people do that. They've actually called our office and said, do you have a nurse named Diane that works for you? And then also keep in mind, they're not going to ask you anything personal as far as a bank account, anything financial. They're really just asking you, and I think we might have sent this out. They're just asking you the questions about your contacts, how you're feeling, and if you need any help with resources. They're not going to ask you anything about, anything to do with your bank account or your social security number or anything like that.
Thank you. That's all valuable information to protect us. And just what information Dick talked about becoming a contact tracer. What could you tell Dick about how we could follow through on that?
I had sent on the document that I had sent you, I actually sent a link to where you sign up to be a contact tracer. But I have so many pieces of paper in front of me, I can't find that link.
Well, we have that. As I said, we put together all the links that you gave us, Dave, and we put them on a sheet, a resource sheet. Even the ones that you did not have on your resource sheet, any place I found a link or a phone number, I put it on that sheet, and that will go out to all the attendees and those who registered.
And can I just say one thing? If anybody that's listening, if you don't anything that you read in social media about COVID-19, I think Bob alluded to earlier that there's a lot of misinformation out there. If you want the right information, you just go strictly to the CDC federal website or the New Jersey COVID-19 hub. It's called the New Jersey State Department of Health website. And then there's going to be a link that'll say New Jersey COVID-19 hub HUB. That'll give you accurate information. But if you're listening to stuff you see on Facebook or other social media, you're probably going to get misinformation, and there's a lot of misinformation out there.
Okay. Yeah, we work next topic in our chat.
What will you do to decide if you will or will not get the vaccine when it's available?
I mean, I'm totally for the idea of getting a vaccine when it's available. I don't know, unless, the medical people came out with some kind of time restriction, I would get it right away as soon as it was available.
Well, I'd like the Center for Disease Control to say it was safe. I think I would go ahead with it. It would be some time before it would get around to the general public.
What kind of trials, when human trials took place, and what, if any, were any of the side effects. So I'd want to know how large the scope of the human testing was. And based upon that, I would make my decision. I'd want to hear from the doctors and the scientists. To me, at my age, being over 70, I would feel that the vaccine was warranted, because if I was to develop COVID, the chances of me having very serious signs and symptoms and conditions, are higher than somebody in their 40s or 50s. So I would want to get the vaccine to prevent some of the serious things that could occur with COVID.
If it's recommended by the medical authorities or whatever, I would definitely get it.
When it first came out, I would not respond favorably. I'd wait. I'd want to wait. But I would contact my primary physician and speak with him. I also waited on the flu vaccine too. I did not get one until I had to. I'd want more information when it first came out from more professionals, I suppose. When the actual vaccine comes out, I'd want to see what the statistics were, what they found out in the testing, and the percentages of side effects, what they are.
If they have a vaccine, I don't know if I would want to be in the first batch of people.
Take the flu shot.
Why not?
Excuse me. I get desperately sick from it.
These vaccines are neither being tested on the elderly nor on children, And I am not sitting around saying, oh, when I get a vaccine, I'm going to go back to the Met. The immunological risks to the elderly is something that has to be seriously considered. And these are not the people that are in the trials. I would want to know what's happened post-marketing on, the first 100,000 octogenarians.
In terms of accepting side effects, I could accept a fever, chills, a fever, and I wouldn't like to accept an upset stomach, but that might be part of it. I guess it's a double-edged sword. But I remember when the polio vaccine came out in 1956, that's how old I am. And my father would not let us get vaccinated because he felt it was too new. And about 4,000 children did die, but that many lived.
If the side effects were low, then as soon as it was available, I would get it. Found out that you could develop some of the same signs and symptoms you get with COVID. You're having difficulty breathing, that sort of thing. That I would, really have to look at. How high a margin was that? Was that less than 1%? Fatigue and aches and pains and redness at the site that would not keep me from getting the vaccine. Right. Again, the risk versus the reward.
It's just like we've got a flu vaccine for the over 65s. We're going to need a COVID vaccine for over 65s.
Hopefully we get a vaccine down the road that will be safe and effective.
My question to our health officers is, our seniors seem to be making their plans for embracing the vaccine or not. And are there current plans underway in our local health departments for involvement in the vaccine information dissemination and making the vaccine available?
Hi, everybody. First of all, I'd like to say that many of the comments that were just made, Mary and Deirdre and the rest, are on target. The answer is yes. There are three major companies that have reached the finals, and they have a vaccine that we are considering. And I might allow Sue to jump in on this.
Can I just?
So basically, there are several vaccines that are in the end of clinical trials. What we would urge everyone to do is to wait for those clinical trials to end and to have the best information going forward and make a informed decision whether or not you're going to get the vaccine. That being said, once those vaccines are available, the health departments throughout Bergen County and the state of New Jersey will be working with the state and federal government to get those vaccines out to the people that need them the most, and eventually to everyone. So again, we're going to wait for the clinical trials to end. Hopefully that'll be within the next several months. And then we will have better information going forward, whether it's something good for us to get at the time. We'll have that information. You want to speak to your doctor, speak to your health department and your family, and then you make that informed decision whether you think it's the right thing for you.
Good job. Yes.
Okay, so thank you for that. And I just wanted to let you know that the North Jersey Villages website has continuously had a COVID-19 news updates and current information. And at the point when there is information that's important to get out to the people, please pass it along to us so that we can put it out on our website. Okay, so our next important question, or the highlights of some of the ways that our life has been altered and as a result of COVID-19, and some of the protocols that we've undertaken. So our next clip.
And that's one of the questions I have for the scientists and the medical people now. If someone feels right now in September that they might have it, what should they do? Because the directions now are different than the directions at the height of it in March and April.
They talk about a new normal now. And I don't know that the new normal is going to include masks forever, like they're pushing right now. But I do think it made people aware, made me aware of the importance of constantly washing your hands, covering your mouth when you cough, things like that.
I would go to the greengrocer in town and literally run up and down the aisles to get what we needed. And I would come home, and like most men who shop and their wives give them the list, my wife would say, well, you got the 6-ounce cream cheese, the 8 ounce is better. And I would say to her, now look, we have to have one word here. The word is availability. If I see cream cheese, I don't care how big, small, or price, you're going to get it. So I would do the shopping, and then I would come home. And in those early days, I would come into the basement. And I would take my clothes off, and we'd wash them and wash everything that I brought in.
I was in Walmart in Garfield. And the people were packing the shelves. And both of them had their masks down here. The workers. And I said to the girl, excuse me, but your mask needs to be put up here. She gave me a look. I said, you may not care, but I do. I don't want it, but I went to the front desk and I spoke to a manager. I said, listen, I know it's annoying. I'm not happy with it either.
My daughter, with great wisdom, first of all, did some basic supplies shopping in February. She said it's time to learn how to use online grocery shopping.
My grandchildren all wear masks, no matter what, they're in the house. They just wear masks all the time. They're so afraid they'll give us something.
How about traveling in a car together with someone else?
Well, all we do is open the windows wide.
Even our kids, we spoke to them on the phone, and my children who live around the block, they would come and we would see them every couple of days, and they would stay on the sidewalk and we would stay on the steps.
With the crossing guards now 30-something years. So now the other day I was sitting on my porch with my dog, and one of the kids came running up, and the mother said, no, don't hug her. And I'm like, oh my gosh. But she says, but I need to hug Miss Jean. So what do you do?
I know.
How do you explain to a 7-year-old that you can't be hugged?
I haven't seen my sister. My niece we wanted to stay away because we weren't sure if my niece was following protocols.
I understand your reservation about, seeing people who go out more than we do, like my grandkids are nearby, but they're out, they have their own little pods with their friends and stuff, and makes me nervous.
Like everyone else, I was more active out of the house. We made plans. We had a canasta group, 4 of us, and when COVID came, we stopped. When all 3 of us were completely well, we've had no issues, whatever. So we since around the 1st or 2nd week of June.
So you have your own little pod.
And some of the girls from the Y take me to my doctor's appointment if my granddaughter can't.
I've stayed very connected to family. I have not been able to really create a safe pod with my family because of their own activities and occupations, the ones that are physically local. When you ask, what does one do in isolation, you rediscover yourself. I had never been without dogs until 2 years ago. And this is a rescue who's been in a bad abusive situation for 10 years. And guess what?
You're rescuing each other.
Well, I think there's been a change now, and I don't know if it's for the good or better, where we are not as careful or restrictive as we were in the beginning. Some people are calling it COVID fatigue, and I think it is. I think we've been doing everything we needed to do for so long, but it takes a toll.
Wow. Those are a lot of interesting experiences in their COVID experiences that our neighbors had. And like, what can Jean say to a child who wants to hug her? And are all the protocols that they follow, the distancing, the personal hygiene, and the sanitizing, are all those still necessary? I think we kind of touched on this before, but maybe we could just
Yes.
talk a little bit more to it.
They are.
Okay. Judy, do you have some?
Okay, so everyone has their degree of comfortableness with the virus. Some people have never been out of their house, have not left their house since it began in early March. Some people act like there's no pandemic at all and go out and do whatever they were doing before, they're doing it now. The tools that we have right now are masking and social distancing, washing your hands and sanitizing. If you can do all that, you can see your daughter or your niece or anyone, you can see family members. If you can sit 6 feet apart outside with masks on, you can be with loved ones. You just have to be careful and be taking care of you. If you don't feel comfortable going out to a crowded supermarket, then you shouldn't go. If you do, if you have your mask on and you have you wash your hands and you social distance, you should be okay. I mean, this is the way we have to live right now. This is the only thing we can do until we get a vaccine, is to social distance and mask and wash your hands.
Some of the information that was shared with us was some research on the types of masks and things like that, and that will be available on the resource sheet. But Dave, if you want to speak to that a little bit, the different types of masks that are available.
I'm going to be honest with you. I mean, my sister made me 2 of my masks. She hand sewn them. I actually made my first mask myself out of stuff I had around the house. This is early when you couldn't get masks. And by the way, that was one of the things with the assisted living facilities. They were trying to get masks and some of them couldn't even get masks. I don't know if anybody remembers, but in the beginning, masks were hard to come by. I mean, really hard. But the 2 things that I try to tell people is, the typical masks, the surgical masks, the ones you get for 10, at a dollar store, they're like paper. Those are good for protecting when you sneeze. The aerosols that come out of your sneeze, it prevents it from spreading out into the room. But if you want to protect yourself, if you're a senior citizen and somebody's in the room and you want to protect yourself against them, then you want to get an N95 mask. No? You say no? Go ahead. Sue's going to speak on
That
this too.
being said, the state still recommends that N95 masks and the types of masks that surgical teams and doctors and nurses need still be kept for the medical field. The best thing to do is to cover your face, whether that be with a surgical mask, like they were saying, the paper mask, or a simple cloth mask. The idea is that you're keeping your
Pinch your nose.
your nose, your mouth, your cough to yourself. You're protecting the person in front of you. I wanted to also say, someone had mentioned about seeing people in the stores not wearing masks properly. I field many calls throughout the day from concerned citizens about going to their local Stop and Shop or 7-Eleven and people not wearing their mask properly. I feel more comfortable sending either one of my police officers or my inspectors to go to a store and educate those managers than to have people like yourselves telling others how to wear their masks. I want everyone to be safe. And it's really important to know that there's many different people in the world and many different opinions that's going on right now. And if you feel like you're in a place and people aren't doing the right thing, call your health department. Let them go out and educate. We have signage, we have the information, and we have the power to back us up to have these managers and these stores follow through with the governor's orders. Confronting somebody in a supermarket, all it's going to do oftentimes is cause the look. Like the lady said, I got the look. And that's not helping anyone. You need to protect yourself. If you're not comfortable near someone, walk away from them. And that way you're protecting yourself. You don't need to confront someone or have a confrontation. Better to protect yourself and do the right thing for you and let the professionals go out there and enforce the executive orders from the government.
Thank you. This is the kind of information about the impact of our local health departments that we may not be aware of, that's so important for us to hear today. And so with that in mind, I want to go on to the next question to talk about asking what the awareness of our nine people that we interviewed about their local health department.
I don't think a lot of the health departments were prepared. There was not enough PPE to go around. I think when it did hit us a lot harder than anybody could have predicted. So moving forward, I'd like to see the health departments, have a good stockpile of PPE and be a little better prepared should something like this ever happen again. It's always easy to Monday morning quarterback, per se. I am part of Mahwah EMS ambulance corps as a driver. So I know the health department got everybody tested, on a pretty regular basis early on. I've been tested 5 times now, negative every time. But, they certainly helped with that. And, they helped us obtain some of the PPE. But as far as the general population, I'm not really sure what they were doing.
We have an excellent health department. They're available. If they can't help you themselves, they will tell you where to go.
Notwithstanding getting wonderfully welcomed weekly information messages from our mayor, which is just amazing. So every week we know what's going on in the town and we remember to use masks, and he's kind of become everybody's like great uncle. I have no idea what the town itself has done.
In terms of a health department, I'm not really aware of it.
I think there's going to be a lot of things that are going to change to just sort of pick up the better parts of what has been discovered about our human behavior from this whole episode. Who can access telehealth if they don't have a computer and if they don't know how to use Zoom and if they are cognitively challenged? Who's training the caregivers and who's training the family and who's helping the families? If we are a cashless society, who has the credit cards? If we are a mail U.S. Postal Service list society, who has email?
Wow, Gail asked some really challenging questions, and the answers might well involve educational programs and printed guidelines or referrals coming from our local health departments. Even the lauded weekly mayor's messages must have relied on information from their local health department. And when Monica said, in terms of health department, not aware of it, what didn't come out in the next clip was that she spoke about, but there is age-friendly Ridgewood, and if you live alone, you can always give them a call. Well, Dawn, I believe that there is a collaboration between Monica's local health department and age-friendly Ridgewood. At least they are a strong communication vehicle. Is that not true?
Very true.
That's very true. Actually, that's one of the biggest things that happened in Ridgewood during the pandemic is, as you know, it kind of came on very quickly. Although the CDC and the state had been preparing for this for years and years and years, it basically came on like a huge wave and we were all so overwhelmed. But one of the biggest things that, because of the support in the community, I can speak for Ridgewood with Age Friendly and the volunteers, we really reached out to a lot of the seniors, a lot of the vulnerable population to see what they needed. We had food drives going. We had programs at Ridgecrest. I had council women delivering thermometers for me. I mean, it was just so amazing. But just so many things just happened all at once. And you could imagine that a lot of the questions that were asked of us, we didn't know the answers. And even asking them up the chain, they were still learning the answers. So I think that was part of the problem. Hopefully, when and if this second wave comes, we have a lot more answers. The same thing with the PPE. It was very unfortunate and very surprising to see that we did not have the stockpiles of the N95 masks. I have a lot of friends who are nurses. Hopefully that has been taken care of and that will not be a problem again. But that was one of the biggest problems that we had, especially in our nursing homes when they were reusing masks. They didn't have the PPE. So that was very important. But I think at this point, generally, if someone has a question, they can call their local health department, or they can visit, if they have computer access, they can visit one of the hubs or call one of the numbers. There's that 211 number that you can even text message and get the answers. And if the answers are out there, we will gladly help you and provide those answers. It's just that this pandemic, again, is still new, even though it's been around for, 8 months now, 7 months. So it's still very new and we still don't know the answers. As you saw just recently, CDC changed the guidelines for close contact. So things are changing every day with that. But people should know that they should definitely reach out to the health department if they don't know an answer. And we would definitely direct you in the right direction. And also a part of Stigma Free Ridgewood, we're also starting a campaign for people to reach out to their neighbors. So stay tuned for that if you're Ridgewood, and we can always share that. Kathy, I can share that with you.
Love
And
to. Yes, get that out on our website. Mhm.
yeah, it's going to be like a template that says like, hi, my name is Dawn Citrullo and I live at this address. Here's my cell phone number. If you need help with groceries or, whatever you might need help with, please know you can reach out, and like encouraging people to bring it to all of their neighbors.
That's great. Some very well-informed older adults who obviously have been staying abreast of what's happening in COVID-19 indicated that they did not know what their health department was doing. So can you just give us an overview of what our health department does, just so we can have a little bit of a focus of what we can come to you for? Susan?
In the city of Hackensack, there are 3 divisions in the health department. There's the Vital Statistics Division, which does all your birth, deaths, and marriage certificates. There's the Environmental Division, which does all of your environmental complaints and all your restaurant inspections, which is always fun. And then there's the Nursing Division. So we have public health nurses that work for the city that take care of any kind of communicable disease. So if there's a communicable disease with someone that lives in town, they investigate that. In addition, they do clinics. So we have flu clinics, we have child health clinics, so a well baby clinic, and clinics for adult immunizations. So that happens several times a month, and they're there every day. Since March, our nurses have been working many, many hours, along with, I trained our health inspectors and our vital statistics staff to become contact tracers. So we've been dealing with COVID since the beginning, reaching out to people, investigating people that have the disease, investigating and working with contacts to give them education, to teach them how to protect themselves and to protect their family members. And we're the boots on the ground. We're there every day. And we give all the information to our mayors and councils, our city managers or town managers, and let them know what's going on between the state and the local of how we're going to move forward with the COVID-19 crisis.
Okay, thank you. that. Okay. And what can someone do if they know someone who is isolated who might benefit from services and outreach that's available?
I just want to, oh, sorry. I just want to add that Paramus Health Department's a little bit more unique, where we have our own human services specialist, and we also have a food pantry. So the human services lady that I know a lot of health departments do not have, she helps people out that need help, and she can give you resources on where to go, and she'll even work with you if you can't do it on your own. And we have our own food pantry, and for anybody that needs food or can't get out, we will assist with that.
Dawn, do you want to speak to
People use
anything
that.
unique about the Ridgewood Health Department?
Ridgewood Health Department is similar to Hackensack. We do not have our own human services, but we do have the pantry, the social services that's located in Ridgewood that addresses the surrounding towns. We actually, though, with the COVID-19, there is a resource that we can connect people that need services. That's someone who's positive for COVID-19 or someone who's a close contact. They can reach out through the contact tracing, and they'll give information of where to reach out to for if they needed meals delivered or groceries purchased or something brought to their house for them, or even financial support.
Great. Okay, thank you. All right. And again, what can someone do if they know someone who's isolated who might benefit from services and outreach that is available? Dave?
I'm actually a retired health officer, believe it or not, and I came back to work for the state. When I was the health officer of Bergenfield, I often sent my one of my nurses out to private homes on complaints. Somebody would say, there's a senior isolated in our home, and I would send a public health nurse to that house, and the public health nurse would just determine what services that senior needs. We actually made home visits. I don't know if every health department, there's 70 municipalities in Bergen County. The county health department has 30 something of them. But that's what Bergenfield used to do. And I can't speak for Ridgewood or Paramus or Hackensack. You want to say anything about Hackensack? What do you do if a senior's isolated? What would you do? Would you send somebody out?
So we have an Office of Emergency Management that we work with closely. If there's somebody that's isolated that needs help, they can contact either the local health department or the Office of Emergency Management, and we could work together to find them the services that they need.
Okay, thank you very much. So one of the parts of the new normal that was referenced by Bob is that we now do telehealth, and we are sending in our packet of information some tips on telehealth. But I have one question just that I'd like to ask is, can we invite someone to join us on our telemedicine so that they can take notes for us or kind of help us with the medical jargon? Is that something that seniors could do, to invite someone to join them on their telemed appointment?
Yeah, I don't see why not.
Okay, so I think that would be helpful for seniors to know, because I know some of them are reluctant to do these telemed appointments. And I think that if they knew that they could have somebody join them, that they were giving them permission with the privacy and all, that would be a consolation to them. Okay, so Janet, do we have any questions in the chat box?
No questions.
Okay, all right. So one of the questions we had asked, were there any words of wisdom from our 9 speakers, and they gave us some interesting answers. We're not going to play the video on that, but I will share one of them, and that was, you can jump up and down all you want, but you're going to end up in the same spot. So I think we have to look for a handle on being constructive and adjusting, and I think many of us have, and to help those who are having difficulty in adjusting. And so Part two of this going forward with COVID-19 is going to be on that, exactly, on adjusting how we're going to celebrate and different things that we're going to do. So we have 7 more clips with 7 more questions that went out to our 9 seniors, and they give us some ideas about how they've adjusted and in different areas, and we would like to share those with you. So there'll be a date coming up in November, and hopefully someone from social services will be joining us on a panel just like our health officers did today. And we'll be able to chat with them and get some ideas about what's available and what we can do to help each other. All I can say, and my mantra is, this too shall pass. I've had enough experiences in my life to know, and some of them not quite as dramatic or all-encompassing as this one, but certainly in my life they were. And I'm just grateful for that. I want to thank everybody. I want to thank our those who were interviewed for being so open and honest with us. And they really did spontaneously talk to us from the bottom of their hearts and what's going on. And we are grateful for that. And I wanted to thank all of our health officers for joining us. I know that this is a very busy time for you. And I really, really am very grateful that you were able to be with us here today. And that people know that you're available and that you're there for us. And I want to thank North Jersey Villages members and those who did the interviews, and our technical people, Columbus and Chinton and John, who put together those clips and I think did a really super job. And those of you who registered, again, who didn't register for this and want to get the handouts, please go into the chat box and give us your email address and your name so that we can send out the handouts to you. And for those who did register, one of the parts of our chats is that if for every 10 people, we give away a $25 gift card. So Janet?
Okay. We had 30 people who registered, so we'll have 3 drawings for the ShopRite card for $25. And I do have all here. Let's see. Joan Larkin.
Oh,
There I am.
with us. There you are. You'll be receiving your, make sure that we have your address and so we can get that to you.
And we have.
You have
my address? No, could you go on the chat and give it to us?
Okay, Mary was one of the people who was interviewed, and Mary is here with us.
Okay. And let's see, the third one is Alicia DeRoy. I don't know that she was on.
See Alicia online now.
Okay.
Okay, thank you, Janet, and thank you all again. Thank you all. Thank you again.
Thank you
for everything. See you in November.
Thank you.